Oxaydo is a medication that is used to help relieve moderate to severe pain. It belongs to a class of drugs known as opioid analgesics, and it works in the brain to change how your body feels and responds to pain. The daily dosage of Oxaydo should be determined by your doctor based on your specific condition and response to treatment. It is important to take this medication exactly as prescribed by your doctor. The best time to take Oxaydo is when you start feeling pain, as directed by your doctor. Always follow your doctor's instructions carefully to get the most benefit from this medication. Before taking Oxaydo, always read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, with or without food. If you experience nausea, taking this drug with food may help. Swallow the tablet whole with plenty of water, do not crush, chew, or dissolve it. Avoid eating grapefruit or drinking grapefruit juice while using this medication, unless your doctor or pharmacist says it's safe to do so. The dosage is based on your medical condition and response to treatment. Pain medications work best if used at the first signs of pain. If you have ongoing pain, your doctor may direct you to also take long-acting opioid medications. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. When used for a long time, this medication may not work as well. Though it helps many people, this medication may sometimes cause addiction. Let your doctor know if your pain does not improve or gets worse. Some common side effects of Oxaydo may include nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness. These effects may lessen over time. To prevent constipation, make sure to eat enough fiber, drink plenty of water, and exercise. You may also need to take a laxative, so ask your pharmacist for the right type for you. To reduce the risk of dizziness and lightheadedness, be sure to get up slowly when standing from a sitting or lying position. It's also important to note that you may see an empty tablet shell in your stool, but this is harmless as your body has already absorbed the medication. Remember, your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as interrupted breathing during sleep, mental/mood changes, severe stomach/abdominal pain, difficulty urinating, or signs of your adrenal glands not working well. Seek medical help immediately if you experience fainting, seizures, slow/shallow breathing, severe drowsiness, or signs of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Oxaydo, also known as oxycodone, is a medication that can help relieve severe pain. However, it's important to be aware that there is a risk for abuse and addiction, which can lead to overdose and death. That's why it's crucial to take the smallest effective dose for the shortest amount of time as prescribed by your doctor. It's also important to be aware that oxycodone can cause severe, possibly fatal, breathing problems. When starting this medication, after a dose increase, or if you take the wrong dose/strength, the risk for severe breathing problems is higher. It's also important to note that taking this medication with alcohol or other drugs that can cause drowsiness or breathing problems may cause very serious side effects, including death. If you experience slow or shallow breathing, unusual lightheadedness, severe drowsiness or dizziness, or difficulty waking up, it's important to seek medical help right away. Additionally, it's important to keep oxycodone in a safe place to prevent theft, misuse, or abuse. If someone accidentally swallows this drug, it's important to get medical help right away. For women of childbearing age, it's important to talk with your doctor about the risks and benefits of using oxycodone. If you are pregnant or plan to become pregnant, it's important to inform your doctor. Using oxycodone during pregnancy may slightly increase the risk of birth defects if used during the first 2 months of pregnancy, and using it for a long time or in high doses near the expected delivery date may harm the unborn baby. It's crucial to take the smallest effective dose for the shortest possible time to lessen the risk. Additionally, babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms, so it's important to tell the doctor right away if you notice any symptoms in your newborn baby. Before taking Oxaydo, make sure to inform your doctor or pharmacist if you have any allergies to opioid pain relievers or other substances. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have any brain disorders, breathing problems, kidney or liver disease, mental/mood disorders, or a personal or family history of substance use disorder. It's essential to disclose any stomach/intestinal problems, difficulty urinating, gallbladder disease, or pancreatitis. Oxaydo may cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you can do so safely. Avoid alcoholic beverages and consult your doctor if you are using marijuana. Before undergoing any surgical procedures, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that older adults may be more sensitive to the side effects of Oxaydo, especially confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant, you should only use this medication when clearly needed, as it may harm an unborn baby. Discuss the risks and benefits with your doctor. If you are breastfeeding, Oxaydo can pass into breast milk and have undesirable effects on a nursing infant. If your baby develops unusual sleepiness, difficulty feeding, or trouble breathing, be sure to consult your doctor before continuing to breastfeed. It's important to be aware of potential drug interactions with Oxaydo, as they can change how the medication works or increase the risk of serious side effects. Some products that may interact with Oxaydo include certain pain medications, naltrexone, and samidorphan. Taking Oxaydo with other products that cause drowsiness or breathing problems, such as opioid pain relievers, alcohol, or muscle relaxants, can also increase the risk of serious side effects. It's important to check the labels on all your medicines and ask your pharmacist about using them safely. Additionally, other medications, such as certain antifungals and antibiotics, can affect how Oxaydo works in your body. It's crucial to communicate with your doctor and pharmacist about all the products you use and to be aware of potential interference with certain lab tests. If someone has taken too much Oxaydo and has serious symptoms like passing out or difficulty breathing, give them naloxone if it's available, then call 911. If the person is awake and has no symptoms, call a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, a slow heartbeat, and coma. Remember to always keep this medication out of reach of children and pets. It's important not to share Oxaydo with anyone else as it is against the law. This medication has been prescribed specifically for your current condition, so do not use it for any other condition unless instructed by your doctor. In that case, a different medication may be needed. If you are prescribed Oxaydo on a regular schedule and happen to miss a dose, take it as soon as you remember. However, if it is close to the time of your next dose, it's best to just skip the missed dose and take your next dose at the regular time. Avoid doubling the dose to make up for the missed one. When it comes to storing Oxaydo, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. And when it comes to getting rid of Oxaydo, it's important to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can find more details in the medication guide or consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.